Assalamu alaikum. Today's article is a case report published in the Journal of Canadian Dental Association in 2012 titled Loss of Sight Caused by Calcium Hydroxide Paste Accidentally Splashed into the Eye During Endodontic Treatment. The case report described a severe ocular injury caused by accidental exposure to calcium hydroxide during endodontic treatment. A dentist was performing root canal treatment on a mandibular second premolar and attempted to apply calcium hydroxide intercanal medication using a syringe and needle. When she noticed that the needle was blocked, she removed her protective glasses to inspect it closely and pressed the syringe plunger. The calcium hydroxide was suddenly ejected directly into her left eye, immediately causing severe burning pain. The dentist immediately rinsed her eye with tap water for several minutes and arrived at the hospital approximately 30 minutes after the accident. At the hospital, the remaining calcium hydroxide was mechanically removed. The conjunctival sac was extensively irrigated with saline, and additional treatment was performed to neutralize the calcium hydroxide. Examination revealed severe chemical burns involving the conjunctiva and the cornea, with cornea becoming completely opaque. Despite intensive treatment, the chemical burn resulted in adhesion between the eyelid and the eyeball, and the dentist completely lost vision in the affected eye. During subsequent follow-ups, she developed complications including corneal abscess and fungal infections. She also required repeated surgical procedures, including 3 removal of keloid between the eyeball and the eyelid, and 3 plastic surgery of the conjunctiva. The authors explained that calcium hydroxide has a very high pH of approximately 12 to 13 and can produce severe alkali burns. Although it penetrates ocular tissue more slowly than some other alkalis, it causes saponification of the cell membranes, and calcium hydroxide particles may become trapped within the ocular fornices, allowing continued tissue destruction. In this case, the authors suggested that incomplete early removal of the material contributed to the severity of the injury. The authors concluded that calcium hydroxide can cause irreversible ocular damage and even complete blindness. Both the clinician and patient should therefore wear appropriate eye protection during endodontic procedures, and if accidental exposure occurs, an urgent ophthalmic evaluation should be obtained. Thank you for listening.